Thank you so much. Thanks for having me. This is a topic near and dear to my heart. You really can't talk about consumerism without talking about price transparency. And you really can't talk about price transparency without talking about healthcare costs. So if we're gonna spend some time today, we can go to the agenda slide. And what we're gonna start with is sort of what does consumerism, what does price transparency even mean to consumers, and why does it matter? You know, historically, it hasn't been, it hasn't really worked. So why should we be bothering to try now? And then we're going to look at providers. Why should healthcare providers care about price transparency? How do providers think about or need to connect the dots between their costs and their prices? And then Pat's going to take us through how to start the journey. This is not an easy process to achieve sort of consumer grade price transparency. Pat's going to take us through how to get started on that journey, or proceed on that journey wherever you may be. I think what we want to do is just to start. Did you know when you joined the webinar, we were going to start by asking you some questions? So I'm going to hand it over to Brooke for a couple of poll questions.
Great, thanks, Deb. All right, first question, I'll go ahead and launch that for you. So we'd like to know, what kind of organization do you work for? Your options are hospital, group practice, health center, clinic, health plan, or other. I'll give you a few seconds to answer that. Looks like we got lots of votes coming in, and they're leveling off. We'll go ahead and close that and share. So it looks like the majority of our attendees are from other. Maybe you can write in the questions pane if you want to tell us where you're from. And then followed by the hospital, about 15%, and then the others are small percentages. Let's go ahead and hide those results, and we'll launch our next question. It's a little bit more specific. We'd like to know what your role is. Your options are administrator, physician, nurse or other clinician, billing or finance staff, or other. Got some votes coming in. Thanks for voting, and we'll take a minute and we will close that poll and share the results. So again, the other category is winning. 62% said other, and then we've got, you know, a little bit of a split. It was 16% administrator, 10% nurse, 10% billing, and 2% physician. So hopefully that kind of gives you some insight, Deb, into who's on the line for us today.
All right, yes, thank you. It really does. Hi, this is Pat Rocap, and I'm going to be talking about healthcare in the headlines. You know, we cannot go a day without seeing healthcare in the headlines or on the nightly news, especially now in the economy that we're in with the national or the global pandemic, and also changing our president. You know, every day the new regulations, what will they be? What will be repealed? We're keeping a very close eye on the healthcare economy. And the main reason why, you know, it affects all of us. We are all patients at one point in time. We're all providers at one point in time. But also the U.S. healthcare spend is about 20% of our gross domestic product. So it's a major cost in our economy. You know, the past year before the pandemic actually hit, the gross spend was estimated at $3.8 trillion. So if you think of that, the magnitude of that, and actually the hospital care is roughly about 33% of that. So 1/3 of that cost is really attributable to those patients that are seeking care in the hospital. So it is a major factor in our economy. And then plus, if you look at your local environment, your local economy, your healthcare providers normally are your largest employers. I actually pulled it up for my state of Indiana today, and beating Walmart, beating the universities, healthcare is the largest provider in our state, or employer in our state. So it really does affect our lives daily, and you know, we see all kinds of headlines. I'm showing a few of them here, to just some of the major ones that affected hospitals. You know, as we've been moving away from a fee-for-service, and the Medicare population has shifted with the baby boomers, we're seeing those profit margins for hospitals decreasing over time. And so that, along with the pandemic, is a real concern, and why we're going to talk a little bit about how this affects the consumer and how it affects the hospital. So if you Google, this was one of my favorite things I did this past week. I just Googled these words, U.S. healthcare is. And right off the top, the number one response or thing that came up on Google was it was broken, it's expensive, it's bad, it's the best, it's not a free market, and it's good. But I really think that that leads us to understand that healthcare is complex. No one has really figured out healthcare because of its dynamic impact to our society and how it is an emotional topic. Some of the more recent things that I was just listening to the news over the past few days, and I love some of these comments that, you know, healthcare is also, it's exciting for our economy right now with the pandemic. I think it's making people feel absolutely wonderful that we're coming to a point where, you know, we're seeing the vaccines come into the market. So one thing I did want to do, looking at those numbers today, was personally thank not only our frontline workers, but the people that stand behind them, the people that are on this call today helping support those efforts to get our economy through this pandemic. So I am going to introduce the next slide, which is really the consumer lens of price transparency. And hand this over to Deb.
Thank you, Pat. And I should echo your thanks to healthcare workers and scientists who are, you know, saving us, treating us, and bringing us vaccines. It's amazing. It gives me a lot of hope. So when we, you know, I think sometimes as someone who studies and thinks about and writes about and advocates for healthcare consumerism, I've had the same conversation on more than one occasion, maybe a million occasions, where some expert or insider, a professor, a doctor, an expert will say like, well, we can't really have consumerism in healthcare. Consumers can't drive healthcare because they don't know what things cost. How can you have a market, a working market, without price transparency? And so, you know, it's sort of like the end of the story for a lot of folks. And, you know, that's just insufficient to me. Like that it's a hard obstacle is true to empowering and informing consumers about their choices, or helping consumers make economically rational choices. But I just believe that there is a path forward, and I think that's what we're here to talk about. If you go back, I just want to say, you know, that when consumers talk about, when consumers think about price transparency, if you could go to the last slide, what we mean is like extraordinarily simple. That the things you're going to buy and pay for with your own money are clearly marked. You know, what you're getting is clear. What it's going to cost you is clear. You have a basis on which to make a comparison and therefore a judgment about what makes sense to you. And it's not a theoretical, it might cost between this and this. It's like, actually, this service you need will cost you this. And so I think a supermarket is a woeful oversimplification. But when you think about consumers' lives, you know, what is consumerism in general? It is driven by this level of, in this image, this level of price transparency. And so when people go into their healthcare lives and they're met with, you know, the opposite, you can advance the slide, you know, they just don't know what to do. And that most people who, you know, go into a healthcare encounter or are trying to pick a health plan or trying to, you know, evaluate a service, feel like the market they're entering really actually doesn't resemble a market at all. It's more like this messy warehouse where, yeah, what you need is in there. It might be exactly right, it might even be affordable, but you'd sort of never know. And what that leads to is a lot of confusion, and worse, it makes people feel both overwhelmed and anxious. So on the next slide, I just want to talk a little bit about, you know, what that costs us in terms of consumer behavior or consumer confidence in the healthcare system. So most Americans, more than 2/3, report having received a surprise bill. And there's a lot of data about very low savings rates in the US. So the average American cannot afford to absorb a surprise bill of, I think the figure, I've seen figures like $400 would be a challenge for many people. And that figure is before the pandemic, when so many more Americans have found themselves in financial dire straits. So those surprise bills are common and they create actual financial hardship. They also lead to anxiety. So 2 out of 3 Americans also report worrying. Not only have they received it, they worry about receiving it, a surprise bill. And there is a lot of data that costs deter utilization, but also that confusion about costs deters utilization. So for folks who are more quote unquote healthcare literate or health insurance literate, that folks who understand their benefits and what's covered are more likely to get care. Folks who are more confused are less likely to get care, even care they very much need, and even sometimes care that would be covered. But literally the fear of those bills that people cannot afford or absorb keeps them from trying to get care at all. On the next slide, I have a little illustration. For my book, I had a team of research assistants and we interviewed, I think something like 50 or 60 or more consumers, and we just gathered their stories about their healthcare spending, essentially, or times when they had made financial decisions. I call that shopping because in any other context, it would be just shopping. That word doesn't mean much to people in a healthcare setting. They're like, what are you even talking about? But really, it's when we spend our own money on healthcare services. So that's what we wanted to get a feel for. What was the experience like for different kinds of people? This woman, it's a code name. We anonymized all our subjects, but this woman was in her 20s. She was in, her first or second job. She didn't have health insurance through her job, so she got it on a marketplace, and she got an ACA exchange Obamacare plan, and then she never used it. She never went to the doctor. And it wasn't that she had no health needs. It was that she was afraid, as she says, I'm concerned that I'm going to go to the doctor and I'm going to have to pay a lot. So she avoided it. She had bought health insurance, and for like a year and a half, she had never gone back to the doctor because she was afraid it wouldn't be covered and that she wouldn't be able to afford the bill. I think that's a good example, maybe a relatively low stakes example of how costs and fear of costs, cost confusion, can really suppress appropriate utilization. On the next slide, we have some poll questions, so I'm going to hand it over to Brooke.
All right, thanks, Deb. So here's our first poll question. Have you ever tried to find the cost of a healthcare service before getting care? So just a simple yes or no. Give you a couple seconds to answer. Lots of votes coming in. And I'll go ahead and close that poll and share the results. So 73% said yes, that they have tried to find the cost of care. What do you think of that, Deb?
It's interesting. I think it's a special group, right? So folks on this call or on this webinar are more savvy, probably less afraid, more in the know who to ask. Because generally data would suggest that this many people want to know the price, but not as many people typically actually go to the trouble of finding out, or I should say trying to find out, because we don't really know if these efforts were successful. But I actually think that's a really positive sign, even given that it's a special population.
Great. Okay, next question. So this is a follow-up. So if you have ever tried to find the cost of care, which we know 73% of you have, did you find what you were looking for? So simple yes or no. Lots of votes coming in. Give you a couple more seconds. And we'll close that poll, share the results. So interesting. 79% said no. Go ahead.
No, I mean, so 3/4 of you have tried, and more than that, 79%, almost four out of five of you have not found what you were looking for. And I think that is terrible and not surprising, right? And that's actually why we're here today, because it's not easy to find. If you've gone to the trouble, you've invested the energy to try to figure out what is this going to cost, and then not gotten what you needed. I mean, that's the antithesis of a consumer friendly system. So I'm sorry that that's happening, and unfortunately, I'm not surprised.
Okay, we're gonna launch our last poll question from this section. So have you ever compared prices across healthcare providers? Maybe a couple seconds, yes or no. Couple more seconds, and go ahead and close that poll and share the results. We have kind of a split here. 49% said yes and 51% said no. What do you think of that, Deb?
I think it's really interesting. Again, this is more. So there are studies. There's a study that was published in Health Affairs, I think in 2017, and it basically showed that people, low double digits, maybe 15% or so. Don't quote me, but basically low single digits of folks had tried to get the cost of their own as one provider, and fewer had compared costs. So it's like more common for people to look for the cost of the service they came for, right? So my doctor says I need this procedure or whatever, what's it going to cost me? A much smaller, like single digits, I believe, maybe 10% say they've actually tried to compare. So that would be what we would think of as price shopping. So it's a very, at least in recent years, it's been a very infrequent behavior. And so I think 50-50 is actually disproportionately high, although it's still pretty low. So yeah, we're not, because the system is not set up to really support that kind of shopping. And here's the data. See, I didn't have to remember it. There are a couple of really important studies or surveys. Public Agenda in 2017 published a really great survey about, they call it still searching. And here's the data I was just saying. So half of Americans have tried to find the cost. So I think I understated that. Yeah, I understated everything. Sorry, I shouldn't have gone off the cuff like that. But here I had fact checked myself ahead of time. So slightly more than a quarter had tried to find the cost at one provider, like I said, and only 20% had compared across. And so 50%, like I said, is high. What I think is interesting, and I know this group is not all providers, but you probably work, probably in that other category are a lot of folks who work with providers or sell services to providers. And I think something that's really important to understand is that almost half of consumers in that study wanted their doctor to tell them the information about cost. There's other data in that survey that said, I think something like 70%, and don't trust me now, I've misquoted the numbers, but these I've like seared into my memory, I'm pretty sure. 70% of people thought discussing cost was a good idea, but only 28% had done so with their doctor. So there's a gap between consumer expectation and desire for a cost conversation and how often that's actually happening. I think also important to note is just under a third wanted to get the information from the hospital directly. And then the survey I mentioned, oh no, I was right, I just mixed up the studies. So the Health Affairs study I had referenced, so half of patients knew the cost ahead of time, whether they asked or they were just sort of presented the information. That's that's not great, but it's not as bad as it could be, and I'm sure it's better than it has been in years past. Only 13% had proactively looked for the cost, which is why that 73% number in this group is actually remarkably high. And then only 10% had compared across. I think I had that number right when off the top of my head, from memory. So here we have 50% of you are willing to shop around. You're not really representative the general population. And I think these numbers belie how difficult and sort of unconsumer friendly the transparency tools are, or how easy or hard is it to find the price. I think if it were easy, more people would be doing it because they want to know. And then just to wrap up, I think this is very intuitive, but I interviewed a man who had just a crazy situation where he got surgery and he got 5 bills over 4 months, and one from the surgeon, one from the facility, something from the anesthesiologist, and it was just a mess. And he basically talks about why is it nobody's job? It seems to be nobody's job to communicate fully about price, and why is that? And then he puts it in such clear context, like in what other situation would a consumer be asked to pay, in his case, thousands of dollars, and that's not uncommon, without knowing the price ahead of time. So if we were looking at other purchase categories, what we have here in healthcare would never fly. And so that's, again, why we're here, to talk about how to fix it. So I think I can, with that, just say that that's the consumer perspective on price transparency. And I think it's very intuitive because, as Pat said at the outset, we are all healthcare consumers or patients at some point or another. But one thing that I think I think that's changing, how consumers, the expectations of consumers is changing and kind of ramping up. But I think the significance to providers is also getting more important. So I'll keep this, I'll take the next slide and just talk a little bit to acknowledge, I worked for a health plan, I think you heard in my introduction, for almost 10 years. And so I really, really understand and empathize with how difficult it is to identify the real costs and how sensitive it is to communicate those costs. So again, in my million conversations with experts who kind of say healthcare consumerism, how can you have it without price transparency? One of the main objections people have is that healthcare is so complex. Pat started us off here, healthcare is broken and complicated. There are many services and codes, and then what is the price? Price depends on not just the service and the provider, but the insurer, where the patient is on their deductible with that specific plan within the insurer. There are many, many variables, and it is extraordinarily complex. There are competitive concerns. Obviously, those negotiated rates are very often held close to the vest for good reason. They're proprietary. Economists worry about the opposite. So not only providers often and plans worry about competitive concerns, economists worry about anti-competitive concerns. So there is a school of thought that with more price transparency, we will see tacit collusion. So Pat and I both post our prices. We don't have to talk about price fixing. We just show each other our price, and we have like a wink, wink market, kind of nod that says, I'll keep my price high, you keep your price high. And actually, it could, work against the stated goals, which is usually, or has historically been, to drive down prices. It can actually work in reverse. And then sensitivity. So I worked for a health plan, and towards the end of my time, a man wrote an angry letter to the Boston Globe. I'm based in Boston. I think it was like he had gotten a sling at a hospital, and he had noted that his insurance company, we had reimbursed the hospital something like, I'm making up these numbers entirely from memory, and already, I've told you that's not the best, but it was something like $72. And he went on Amazon and found the exact same sling for $10. And he wrote, like what gives? Why would you spend $72 on something that I could get myself for $10? And I have many thoughts about this. One is like, I put that on my list of, and this is why healthcare costs too much. But the other is that, of course, it's not just the cost of the sling, it's the cost of the facility and the administration and the services and the providers, and it's a lot more complicated. But the to the naked eye, to the consumer view, a lot of healthcare costs do not pass the smell test. And so I think there is sensitivity, appropriate sensitivity, and still we have to get to the place, I think, where we can show our costs without worrying about, shame from angry customers or just logic. So I think that what's really essential to, and I assume you're here on this webinar in recognition that this is not optional anymore. Price transparency has been around. It's been a topic for a long time. Folks have spent a lot of money on solutions that did not work that well, did not drive down costs, did not generate adoption from consumers. And I think there was a bit of like, this is really hard, and oh, why do we have to do this? Not really focused on it. Well, it's coming back, and there are two, and maybe for some folks it's never left, but I think now we're in a different place with price transparency than we ever have been. One is that consumer expectations are, I said this earlier, changing because actually consumers are paying more of the bill. And finally, I think understanding that. So when I started my journey and writing this book, there was still a lot of confusion about what do I have to pay? I don't know what I pay even. I think that I want to say ignorance, but I don't mean, I just misinformation or lack of understanding of consumers' own costs is changing because it's unavoidable now, because consumers are paying more than ever before. Almost everyone, even people with great insurance through an employer, has a deductible, so they're paying. And those not only do more people have deductibles now and higher out-of-pocket costs, the absolute dollar value of those costs is higher. 65% of employees with employer-sponsored insurance have co-insurance. That's remarkable. That number has shot way up in the last several years. And if you have co-insurance, you actually have no idea what you're gonna pay unless you know the cost or the price. So that is a number to watch. Then there's a lot of innovation, a lot of pressure from the outside. Silicon Valley is hot to trot. We can fix healthcare. We know how to make consumer grade technology tools, so we're going to fix it. I'm skeptical of that, but I think it's there as a force. And then finally, regulations is, really, going to put the thumb on the scale to make price transparency a priority that providers can no longer ignore. And with that, I think, Pat, I would love to hand it back to you to kind of go deeper into some of that regulatory framework.
Yeah, absolutely. Thank you, Deb. Very insightful. So many of us know that this past January was really the beginning of hospital price transparency. The regulations and a zoomed out view here look pretty simple. You're to present your items and services in two different ways. You have a comprehensive machine readable file with all your items and your services. And then the second way is to display a shoppable service, a list of these shoppable services that are consumer-friendly format. So like I said, this information was required to be on the hospital's websites starting this past January. So looking at it in just a little more detail, if you look at the CMS guidelines on this, the machine readable format required some different layers. It also included your gross charge, your discounted cash prices, your payer-specific negotiated charges, and de-identified minimum and maximums for those negotiated rates. And I can tell you it is definitely machine readable. It's not human readable. I peeked in a few, did some, my due diligence work, because it was actually being an accountant and being in healthcare for decades. This was exciting for me to actually go out and look at a few websites, find the information. A few of the hospitals that I looked into, I couldn't actually even find the data, so I don't know if it existed. Other ones, it was so simple to find. I just put in hospital charges on their search command, and it took me to these sites. So when I looked at these lists, they're not, this would not be where a consumer would go under this first item, the machine readable file, because unless you know specific things like CPT codes and J codes for drugs and injections, it would be very complicated to actually find what you're looking for. But I have a feeling that competitors have definitely been in these files, along with insurances and large employers. I think they would be the most interested in some of this data right here. And then second part is the consumer-friendly display of shoppable services. Unless you have a price estimator on your website as well, that price estimator also has has to display the 70 defined CMS items, and these items really were centered around what can you pre-plan, what would be something that's non-emergent, let's say. So Medicare defined both inpatient, outpatient, but I did look at the shoppable services, and I have to admit I kind of picked on a particular one. You're going to see the next slide showing actually that price estimator on a specific item. But again, it's plain language, which I did find, and at a couple of the websites I looked at. But you needed to have that information of, you know, and I always put it up as a self-pay because I really didn't want to get into the insurance part. I wanted to see what the self-pay point of view would look like. But it does get into those payer-specific negotiated prices. There's a spot where you can look at your particular provider of your insurance, and you can still see those de-identified minimum, maximum of the negotiated charges. So like I said, I did a sample of one. I picked on MSDRG 470. Most of you probably know that one off the top of your head, being a joint replacement, because CMS has done a lot of work around, especially this particular area, with bundled services or bundled payment packages. So I looked on the hospital website, and it was real easy to find, like I noted, for this particular provider, and I put in self-pay. What I found interesting around this, the regulations do specify that you need to put in your professional services for your employed physicians. So it came up with a cost that would be normally billed like on your universal billing form for all your hospital services during that inpatient stay, what the adjusted charges would be, and what that line item would be that the patient would be responsible for in this self-pay scenario. What I found most interesting, though, was around the professional services or the professional procedures, was it really didn't tell me what doctors. And we talk about surprise bills. This is really going to be an area where you're going to see those surprise bills come up, because it's telling me this is an outpatient surgical professional. Okay, is that surgeon? Is it the anesthesiologist? And what about the other services that I know there would be a physician component for, like radiology, pathology? Those two items, especially radiology, are going to happen on a joint replacement procedure in a hospital. Those scans are done quite often. So it's still very well undefined as to what those professional services are really covering. And I think that's one area that there needs to be more clarity on. Another thing that this really doesn't show you for that consumer is, what are the pre and the post services? Where are those? What could those be? Because most patients that get this type of procedure, especially post-discharge, you could possibly have a stay in a skilled nursing facility for a shorter period of time where you're rehabbing. You would also have physical therapy. There could be drugs involved. Those prices are not in this consumer lens, and that's just something that needs to be brought to the patient's attention, the consumer's attention, that this isn't the total price of having that procedure done. And a little story here, you know, I consider myself pretty well versed in healthcare. I had a situation a few years ago where I was going for an upper GI. I made sure it was in my plan. The doctor was in my plan, but the thing I forgot about was the anesthesiologist. He was not in my plan, had to pay quite a bit of that service myself because he did not discount for out of plan patients like myself. So the missing link really between price and cost. So two things I really want to talk about in this realm, based on the conversation you're in, you know, what is price, what is cost? So if you're looking from the consumer lens, that cost is the amount of the healthcare provider, the charges that that patient's going to be responsible for. But if you're on the hospital side, cost and price are two different things. You know, all the expenditures or the cost of providing that service to the patient is your cost. But then the provider has to construct charges or prices to cover those costs of those services being provided. So this brings us to probably the most complicated part of, you know, billing and pricing. In the U.S., there's a charge master, and we're going to simply define this as a charge descriptions, your CDMs, that simply define it's a comprehensive list of all your billable procedures to a patient. Sounds simple enough, but in reality, it's a lot more complicated because our regulations in the United States are set into what we call CPT coding, HCPCS coding, ICD-10 procedure coding, plus the common diagnosis procedures. And that really comes back to, you know, the cost of the service. You know, it gets so complicated to structure your charge master in alliance with these regulations that sometimes the cost of that individual item gets lost in the complicated world that we're in. And the reason we need to have charges in this structure is that our reimbursement system, especially from the government, is tied to this type of coding. So, oh, we got a poll question. I'll turn this over to Brooke.
All right, thanks, Pat. We got two poll questions for you. I'll launch our first one. So do healthcare providers understand their own operating costs enough to construct a charge master in accordance with billing regulations? Give you a few seconds to give your opinion on that question. A couple more seconds. And I will close that poll. It looks like 88% said no, Pat. Is that what you expected to see?
I definitely thought I would see that.
Perfect. Okay. Hide those results and we'll launch our next one. So for this question, we'd like to know, how confident are you that you understand your organization's costs? You can say extremely confident, somewhat confident, or not confident. Give you a couple more seconds. And I'll go ahead and close that one and share the results. So it looks like the majority said not confident. 51% said not confident, and 39% said somewhat confident, and only 10% were extremely confident. What do you think about that, Pat?
That's kind of what I would expect. I'd be interested to find out the people that are extremely confident, how they look at their cost, because that's going to be the next section that we're going to talk about, looking at your costing in relationship to your transparency. So how to start your journey to really find out, you know, how you can be more transparent. So I think the first step, you know, is really look at, you know, we've gone through as an industry some major changes, especially changes that affected hospitals. We've had just great innovation in our enhancement of clinical care. Every day things are changing. I mean, healthcare is not a straight line by any means. It is fluctuating, changing every day. One of the biggest changes, you know, living in the hospital system the way I did in provider system, was the birth of electronic medical records. This has just been one of the greatest things, and also one of the probably a nightmare for many hospital systems. It's expensive, it's complicated. We've heard about provider burnout, having to click so many screens. So it's just been it's a wonderful thing, but it's also, you know, a nightmare, you know, depending on where you're at in your process. And then one of the greatest things from my point of view, being an accountant and loving data, is the electronic data warehouse. I mean, we have so much data that we can put in there for the first time and start leveraging that data, integrating that data with other data, and getting to that point where we can take that data and it can provide more insight for us to become better innovators. And then the regulations. This for me, and I can talk a little bit about it, when the Medicare shift away from using the old cost reporting systems to reimburse their fair share of costs and really switch to a DRG system, a diagnostic related group system. Originally, there were just over 400 in the 1980s when we made the switch under the TEFRA laws. That's when hospital price shifting really started to take birth, I want to say, and how the charge master became an important role in trying to provide more insight to the bottom line. What most hospitals experience is that those DRGs, those prospective payments, really were not keeping up with delivering the true cost of that healthcare. Those DRGs, especially when it comes to the components around medical supplies, the labor costs, the drug costs, we saw the industry shifting and prices increasing dramatically, but the DRG payment remained low or lower, and it really wasn't keeping up with that cost of providing that services. Some other changes that also happened around the 80s were Stark laws. And Stark laws are going to be revisited, I think, very soon. Some of them have been lightened in lieu of the Medicare regulations around bundled payments. You're allowed to have certain negotiated relationships that the Stark laws actually had prohibited back in the 80s. So I think revisiting those laws is going to be very important over our next decade, let's say, as we're moving and shifting to these different payment models and arrangements that we have to improve our healthcare system. Some of the other big laws were the Healthcare Insurance Portability and Accountability Act, which was really around, you know, the HIPAA regulations, and then President Obama's Affordable Care Act, which was really based off of the Massachusetts healthcare reform policies that were in play. And one thing that's interesting about the Affordable Care Act is that is something that's still in the news every day. It's something that even in the first few years where it was put into place, there were 70 different initiatives just in Congress to change or modify that law. So it's something that still affects us every day. You know, how will this really play out? And then there's some macro trends. The aging population and as the baby boomers have hit Medicare age, and that payer mix, that change that we're seeing in how it couples with that reimbursement. Then the cost pressures, you know, there are cost pressures in healthcare. You know, we've had the innovation in our, let's say, even in cancer research, been one of the most innovative areas, but cancer drugs are very high costs. And then global public health concerns. We've had several over this past couple decades, and obviously the most significant one is the current pandemic we're in right now. So I want to talk about how healthcare, do they really understand their own cost? And, you know, the thing that I see in healthcare, and this really came about in the 60s and 70s and 80s more. I hate to admit I've been in it that long, but we see a costing system in healthcare that's really siloed. It's usually just based around the general ledger and how the general ledger is structured. It uses very departmental cost to charge ratios, or even relative value units that are attached to charge codes that were one time maybe time studies and how this value relates to the cost within that service line. So it's a very antiquated system. And I would challenge healthcare providers to look to different ways to doing that, because like I said, the onset of the medical records and the EMR having data in a warehouse really can provide you more insight. So one thing that let's see, I'm gonna see if I have any other notes on that. One thing I really challenge hospitals to do is try to break down those silos of costs and look at activity and how that activity is really driving costs, and get to methodologies where you can find true costs. So, you know, one particular area I'm going to maybe even focus or zoom in on a little more is really looking at your cost with those actual activities, like in the OR department. This is one that's rich in costs, but it's also rich in a lot of different service lines really can use that department, and the cost is high, and the cost of surgery is high. So if you're looking at a traditional scope, you may say, oh, look, these physicians are bringing in more money based off the services they're doing in the operating room. Their charges are higher. But look at why their charges are higher. Are they using more expensive medical supplies? Are they using more labor? Are they taking longer in the operating room? So look at those things that really drive the cost, the medical supplies, what you're purchasing them at. Also look at, you know, what does this doctor require for the time, their block scheduling. So use those drivers of patient minutes. Use the drivers of, you know, this is the medical supply, and I can explicitly cost. I know what those items are. Probably the best thing I had my experience in was actually showing physicians their costs in the operating room. And most people would think that they don't want to see it. But what I found with physicians, and I heard this comment more times than not, I've always wanted to know this data. Nobody's ever been able to tell me what my supplies cost. And looking at the data, even across common procedures, I worked with a fascinating group of general surgeons who wanted to look at their procedures, their costs among their group. And the physician that was leading this, my champion, was actually my highest. He used the most expensive supplies. One of the things that came out about that was he liked a certain type of surgical mesh, and he thought it rolled out quicker and easier. But one of the other surgeons, in just a simple conversation we had at a round table, was like, well, I can show you a different technique with this mesh. Within a week, he was in her operating room, learned the different procedure, was able to actually save costs, even though the charges might have been higher on that one mesh, but you're only reimbursed so much normally. So he was saving costs to the bottom line by finding a new technique, being innovative in his thought process, and using a different supply. And this is something that advanced costing can provide and put in the hands of the clinician and help really improve the cost, which in turn can improve your charges. So I like to look at this in a flywheel. Honestly, just understanding your true costs can really lead to different improvement processes across your system. Once you identify that true cost, you can work with your physicians, see those variations in practice, find and identify the best practices, and work toward that type of practice across your system. It also identifies and removes that variation that you'll find, that waste that you'll find. We talk about healthcare waste being, you know, approximately $1 trillion a year. One way we can cut healthcare spend is to reduce that waste, what we're seeing existing in our society. And once you have those two concepts, you can really look at your pricing structure and align it and become more transparent. Feel confident that you are charging in accordance with your costs and not just using some departmental cost to charge ratio that's an antiquated system to kind of to back into a charge. Now that you know your costs, you can look at your charges and know that they're in a line. With that, it definitely leads you into a better marketing position. That you are comfortable, that you can show those prices, be confident in your transparency. Another great aspect of this is really knowing your costs. You can really improve some of your contracting. We're in a market that is really based on risk marketing and risk sharing. And one of the things I know that it's coming out that there's some early numbers around this, that hospital margins actually improved during the pandemic, even if you take out the CARES Act, because of these risk contracts. Unfortunately, people were afraid to go to the hospital. Hospitals actually did better in those risk management contracts at that time, but there is cautionary steps that some of this is definitely going to lead to those patients coming back and might have a higher risk of comorbidities because they didn't seek hospital care maybe in a timely manner. But I really feel that knowing your true costs just keeps this flywheel spinning. You can move through different areas and improve your innovation by using that agile approach of looking through service lines and breaking down those definite silos of costs and activity. So I'm going to turn this back over to another poll question.
Great. Thank you, Pat. All right. So now it is giveaway time. So if you would like to be entered to win Deb's book, it's called The Healthcare Consumers Manifesto, How to Get the Most of Your Money. Please answer this poll question. We'll give you a couple seconds to answer, and we will pick 5 winners after, and I will contact you to get your address and make sure you get that book. Give you a couple seconds to respond. Couple more seconds. All right, go ahead and close that. And now would be a great time if you have questions for Deb and Pat to submit those in the control panel, and we'll start our Q&A session in just a minute. I'm going to launch one more poll for us. This is our last poll of the day, so thanks for your patience with all of these. So our final poll question is, I know that today's webinar has been focused on healthcare consumerism and cost, but some of you might want to learn more about health catalyst products and professional services. So if you'd like to learn more, please answer this poll question. And I'm going to leave that open for a couple minutes, and we will jump into our Q&A. Okay, so our first question, Ferris asks, for consumers, doesn't the publicity around the variation in healthcare prices 10 times at times in local markets on the same procedure greatly impact any confidence they might have in price transparency? How can they trust healthcare pricing? I don't know who wants to answer that, Deb or Pat.
Yeah, I can chime in, and then Pat probably has something, if Pat has something to add, but it's a really good point. I think one thing the question presumes is that consumers understand and are aware of price variation, and actually that's growing, but it's not universal. So I actually think that raising awareness about price variation is one lever that potentially could lower costs, although it could also work the opposite way. Like I said earlier, it could sort of nudge some prices higher. But I actually think a lot of consumers don't understand that there's price variation, which is why they don't shop around. Not only is it not easy, but they don't even know that there would be a difference. I think consumers who understand that there's price variation, does it erode trust? I think it erodes trust in not necessarily the price information, but in the system, even on a broader scale. So I think it's a really good question. I think it's really important. I think consumers who recognize that hospital A can do a knee for, I don't know, Pat would have to tell me the number, and hospital B does it for 3x or 10x or 2x. I think that erodes confidence overall. So yeah, I think it's important, but I don't think the answer is to hide the prices. I think the answer is to sort of push forward into greater awareness and more conversation about it.
Yeah, the only thing I definitely would add there, I think you will see prices vary based on the organization, and if they're a center of excellence in that particular area of care. I would anticipate that, if you are going to go to the Mayo Clinic, if you're going to go to areas that offer a premium quality of care, you might see price transparency. You're going to see a difference in those prices. Just because of the specialization or the individual, all care is individualized, but I think there will be still premium services that will have higher costs.
Perfect. Okay. We've got lots of questions coming in, so I'm trying to see what we can get through. We might go a little bit over the top of the hour, so if anyone's able to stay on, please stay on. If not, this will be recorded and you will get access to it later. Okay, Eric asks, going back to the total versus adjusted charges, does a hospital or a professional get to deduct the difference as a business loss, i.e. a tax benefit?
No. The difference between a charge and an agreed upon payment is considered a contractual allowance. So it's not really an expense, but it's reduction of the revenue that's been collected. So you will see a gross revenue item. This is typically how a non-for-profit hospital or organization will report. They would report their gross charges. They would have that contractual as a deduction of revenue, not an expense, but a reduction of the revenue to have then a net gross revenue. So, and then expenses would follow under that. But it wouldn't be that write-off, or that difference wouldn't be an expense to the organization or on your books for tax purposes.
Okay. Next question is from John. Will value-based plans lead to better price transparency?
Deb, do you want me to take that one?
Yeah, I'm thinking about that. It's a good question.
I really think it will. I think, if it's a value-based plan and you're really, and this is where I talk about, even more like a center of excellence, and really looking at that, the triple aim of healthcare and providing high quality. And I really think it does lead to price transparency. I think that I'm not sure if I'm answering the question right, but I really do believe it will lead to more and more price transparency in our society.
Do you want to add anything, Deb?
I'm puzzling on it because I don't actually know the answer. I think I certainly hope it will. I think my experience with value-based contracting is, I haven't worked for a health plan since 2014, so my experience is, a little older in this regard. But at that time, anyway, value-based contracts were still essentially adjudicated, or sort of claims were priced as fee for service and then sort of reconciled in the end. And I think that doesn't really, the changes to behavior, really come, I think, after a more mature, on the other side of a more mature process than that. So I think it's possible, but I think let me say it this way. I think there are a lot of things we've thought would automatically improve price transparency over many years, and they don't. It doesn't automatically happen. So I think providers engaged in value-based contracts will need to decide that this is a lever or a mechanism or an opportunity to expose to greater transparency. And if they do not decide that, they can probably get away with old behaviors. I don't think they'll get away with old behaviors for long, but I think it takes a concerted effort and commitment.
Okay. Next question, Christina asks, who is creating the greatest obstructions to providing price transparency? What can we do to advocate for clear transparency?
You want me to take it? I think, and Pat probably has a different view, or a different lens, not a disagreeing view necessarily. But I don't think there's sort of a bad actor. Somebody's blocking, a single actor or a single part of the system is sort of blocking transparency. I think the greatest enemy of transparency is complexity, one, and incentives. So if I'm a payer or a provider, I don't, until the regulations really force the issue, until consumers really force the issue by saying like, hey, knocking on that door, I'm paying this bill, what's it going to be? I think inertia and the lack of incentive to change those are the biggest factors getting in the way of transparency. I personally think that it's the negotiation between payers and providers is sort of at the root of that complexity. Actually, both sort of makes the system more complex and the incentives more complicated. So if you look at markets or parts of healthcare where there's less insurance involvement. So I've done a deep dive into the mental health care market, which is quite a bit more cash pay than overall medical spending. And there's consumers anyway, they know exactly what their mental health care costs are going to be. They pay them, they don't accumulate giant balances. There's not this manipulation of codes and inflated rates and partial payments. And it's just sort of like, I go to my therapist, he charges me X, I pay him X. If it's a problem, we talk about it. That's a oversimplification, but that is a lot of the story in mental health care. So I think we can look to the payer-provider relationship as the source of both complexity and inertia is not quite it. It's not just inertia, it's willful inertia, deliberate inertia.
Okay. I'm going to try and get a couple more questions, and I know we're a couple minutes over the top. Deb and Pat, are you okay to stay on for a couple more minutes? Okay, Peter asks, how much is the penalty for hospitals that do not provide price transparency? Will those penalties be just part of doing business?
Yeah, Medicare has come out and said, or CMS has come out and said they're going to be, auditing the price transparency at the hospital levels, and that monetary fines can and will be waived. They haven't said what those are. They haven't given dollar values when I researched it on their website, but much like probably any type of penalty you could get from Medicare, they'll try to make it maybe material if you don't heed their warnings.
Okay. Next one comes from Terrence. What about non-health system providers? Do they need to publish real prices, negotiated discount rates too?
Currently, the regulation is on hospitals, whether if they're for-profit or non-for-profit. They both had to report this past year. Other price transparency regulations are in the works now with the final rule that came out in October of this past year. The insurance companies are really going to be some of the ones next that are going to have to show more transparency in their pricing to the consumer.
Perfect. Okay. Next one comes from HP. Are there any new ICD codes for COVID expenses for hospitals to reduce operating loss or cost, or to apply to insurance claims codes to get full payment?
Okay, I'm going to ask you to repeat that one more time.
Yeah, so it says, are there any new ICD codes for COVID expenses for hospitals to reduce operating loss or / cost, or to apply to insurance claim codes to get full payment?
That one I'm unsure of. I thought there was some coding that came out last April around the coding for COVID, but I have to admit I'm not a per se coding expert anymore. I took off that hat probably around 2012, right around the time we went from 9 to 10. So I could follow up on that.
Okay, perfect. Okay. Sorry, I'm trying to get through as many as we can. We have a lot of questions. We're going to get through as many as we can, and if not, we'll follow up offline. So Polly asks, do you perceive the varied insurance coverages create a fragmented consumer market, which makes it more difficult for consumers to band together to demand change?
Hi, Polly. We met, I think. I think it's you. I think that's a great question. I think there is no kind of uniformity. There is no organizing force for consumers other than certain, condition-specific advocacy groups or age, like AARP for older Americans and Medicare. And I think that there is a lot of fragmentation and a lot. So I think it's a really good question. Yes, is my answer. I think that there is also a lot of how to put it, lack of empowerment, and lack of imagination. So I think a lot of folks don't understand what it would even look like to advocate or speak up. I think many people don't feel qualified or entitled to ask the questions that might start, if we all did it, it would start to force some change within the industry. I think about employers as gatekeepers, and then I think about the marketplaces, and folks who buy their own insurance tend to know more. Actually, they tend to understand their benefits better, but also have don't understand that maybe their state could be an advocate, or that there are public agencies that could advocate for them. So I do think the fragmentation is a genuine issue, and there is no kind of unifying voice of consumers writ large.
Thanks, Deb. Okay, Susan, next question from Susan. Shouldn't any price transparency info for consumers also link to quality metrics and outcomes as well? Anyone want to respond to that?
Yeah, Pat, do you want to jump in, or?
Go right ahead, Deb. I can add a little at the end of that.
Okay. Yeah, I think that, so when I think about value in healthcare, or value in anything, actually, I think about a combination of cost and quality. And so there is or should be a relationship. I think we know, and folks on this call and whoever asked the question about the variation certainly knows that cost and quality are not correlated in healthcare. So I think that those concepts should go together. On the other hand, I've also heard that argument, and not you're asking it as a question, I've heard it as an argument against price transparency. Let's not publish prices because, prices alone don't mean anything without quality. Consumers need, sort of both ends of that equation. And I think that is not actually true. And here's what I know. There have been studies. A lot of my studies come from health affairs, so I'm pretty sure it was in health affairs, where they actually did focus groups with consumers who on evidence-based care, and the consumer perception was that evidence-based care must be worse because their doctor, their healthcare provider, was no doubt already providing the best care. So the consumer perception, we know evidence-based care raises quality, or should. But the consumer perception or assumption is that their providers, whom they trust and rely on, are of course providing good care. That is the baseline assumption. And so, if that's what you believe, and you're paying out of pocket, price and cost may matter more, to be frank. That doesn't mean it's not important. We know there's variation. We know you should look at, we as industry insiders know you should look at both. But the other thing I would say is, when you have financial hardship, which millions of Americans do in general, and specifically regarding healthcare costs, to some extent, it's like you've got to trust that the doctors are going to do the right thing. And it really comes down to, like, what's in your wallet, what can you actually afford? So I think, yes, in a perfect world, we marry those two dimensions. It's obviously really important. But in reality, if all you have is this much, or not enough, then a lower price or knowing the price will make the difference in your decision making, whether or not the quality metrics are alongside it.
Perfect. Okay, we're gonna do 2 more questions really quick, and then we'll follow up, or you can see Deb and Pat's emails are on the screen if you'd like to contact them with your questions. I'm just gonna pick out 2 more. Let's see. Christina asks, can consumers report the lack of price transparency?
I believe you can, just like any type of Medicare concern that you would have on their website is a place where you could report that, or you could directly call the hospital. It could be that you're just not finding it on the website. They may have it. It just may be a little more difficult to find. And I think there is a learning process right now going on to make that more visible.
Perfect. Okay. And this will be our last question. Stephen asks, what's the best way to get consumers to actually start shopping for price?
That's the $1 million, that's the $1 billion, no, it's the $1 trillion question. Americans pay about $1 trillion out of pocket every year on healthcare and coverage. So it's the $1 trillion question. I think the best way to get consumers to use price information to actually base their decisions, make decisions based on that price information is make the data meaningful. So some of what Pat showed as, machine readable but not human readable, that's not going to do it. Make it contextual. So I don't care what it costs in general. I care what it costs me now. I'm sitting in my doctor's office. I'm, at the ER. Whatever is my situation, I care about my costs, my specific costs, my exact costs now. So contextual, make it easy and clear so it's usable. And then I think to one of the last questions about quality, I have to know what I'm getting. I have to know that it matters. I have to know that I have a choice, and I have to actually have a choice. There are certainly markets where that's not the case. Where I am, I could throw a rock and hit, 10 hospitals. So in markets like this, to be aware that I have a choice, and then to have easy access. So actually, even just going to different hospital sites, that's like the old days of health insurance, calling. If you didn't have employer coverage, call individual insurers if they would cover you, compare their prices. I've interviewed consumers who describe printing out or, getting brochures and laying it out on the kitchen table and comparing each one side by side, that they had to gather and put that comparison together. And of course, most people won't do that. Even this price transparency regulation, having to go to each hospital, that's not easy. So, I think that when price information is as easy as air travel. Has anyone been on a plane? I haven't been on a plane in a really long time, but how to find, you can compare a gazillion options for a flight from here to there. And it's pretty easy. It can be almost too easy. It's so overwhelming. Until it's that easy, I don't think we'll see really wide and deep adoption. And excuse me, I also think that now I'm on my soapbox. I really think that it's when providers, like right now, the regulators are dragging the market to transparency because we're not doing it on our own, or we're not doing it well. I think when providers or payers, but probably providers, say, you know what, I'm going to actually leverage this. I'm going to use this to my advantage. I'm going to win consumers' hearts and loyalty and dollars, by doing this really well and thinking about what's behind transparency. Just pulling back the curtains on muck is not going to do it. Cleaning up the muck underneath. I use this analogy. It's like if you clean up for guests. I also haven't had guests in a really long time. And you shove everything, in a closet and then close the door and hope nothing falls out. It's not really clean. We have this debate in my house. It looks clean, but it's not really clean. And you cannot open the closet door. But if you say, you know what, we're going to really organize, we're going to see what's in that closet, we're going to throw out the junk and organize what's left. And we're going to then welcome our guests to hang their coats in the closet. I'm making up just a hypothetical situation. Haha. You know, that's when folks will really understand that, you know, they can trust the prices, they can ask the price, they can compare across providers, get meaningful information, and make decisions based on it. Have I overshared with my closet story?
I think we've all been there, Deb.
Thanks.